I'm sorry, what would you? Okay, everybody. I'm here today with Dr. Sasha Blaskovich. He is a board certified chiropractor. And today we're going to be talking about Nuka, which is a topic that I've talked a lot about in podcasts and done posts about. I've shared my journey with having this treatment for, I don't know, almost a decade now in my life and found fantastic results from it. So, Sasha, thanks for doing this.
My pleasure. Thanks for doing this too.
So let's just jump right in. A lot of people have never even heard this term. What is Nuka?
National Upper Cervical Chiropractic Association. So basically, it relates to addressing the topmost bone in the neck, which is named the atlas, and with the premise that the atlas being out of position can cause a gamut of neurological symptoms, which affect, or it'll affect the brainstem, which then results in a gamut of neurological symptoms that go undetected or undiagnosed in the medical system, because it's rare that the medical system pays any attention to this region of the body. And Nuka practitioners, that's their whole focus. And myself personally, as a chiropractor, I'm not a Nuka practitioner, but I have the utmost respect for Nuka practitioners and any of the derivatives thereof that focus on the atlas, such as atlas orthogonal, which uses an instrument, and advanced orthogonal, which also uses an instrument embedded in a table. And so the results are miraculous. And so basically, Nuka is focused on the uppermost cervical vertebra, and how its malposition at any given time can cause a neurological compromise, which leads to a whole bunch of systemic body-wide problems.
Okay, so for the average person who, the atlas and upper cervical, so what we're talking about, and feel free to correct me if I'm wrong, is the head or the neck is fitting on the spine, like that kind of thing. And we're
Yep.
talking this, like where the head connects to the spine. Is that right?
Pretty much, yeah. But the atlas actually is more of a holder, a cradle, and the skull's got rockers on it that fit on top of the atlas. So the skull fits on top of that first bone, and the first bone bears the weight of the skull. And so it's extremely important in the governance of the connection between the skull and the spine, so the brain and the body, basically. And so it's extremely important.
Okay, so what happens if this is it a joint? Is that what it is? Like, or is it a? Is
Yep,
that what you?
100%. It's a joint. So the joint between the skull and the atlas, the top bone, it's actually just mainly a rocker. So basically just a forward and back motion of the head. The one below that, where the atlas connects to the second neck bone called the axis, that's where a lot of magic happens, because that joint is the most mobile joint in the human spine. So it's got a gamut of ranges that it's supposed to function in. And it's usually that junction point where people, especially after trauma, have problematic issues that lead to symptoms that will eventually hopefully bring them to a Nuka practitioner, and have that addressed and evaluated, and hopefully restored and repaired, so that they can regain a level of life that they deserve to have.
Okay, so we're quite literally talking about people whose heads aren't on straight. Is that the idea?
Basically, yeah.
And so once your head has been, you've had either a car accident. Now, can this happen with a forceps birth or even before when
Of
you're
course,
little?
yeah.
Okay, so
Yep.
you're little. You've had your head is not on straight, so this joint is off. Now, what are the ramifications, or what are the effects for someone whose head aren't on, whose head isn't on correctly, or this joint isn't done
Yeah.
right?
So the most simple mechanical explanation is that when it's not like that, there's rings that superimpose, and those rings are just supposed to rotate on each other. But when those rings start offsetting like that, which is what eventually happens with these cases, now what's going through that tunnel is the brainstem and the spinal cord. And so if things are rotating around the brainstem and spinal cord and not contacting them, you can function fine. There's no neurological compromise. But as soon as these things start offsetting and reducing that overall internal diameter of the junction point of those bones, now you start getting direct pressure from the bone on the brainstem and or spinal cord. And because the brainstem and spinal cord relay electrical information and signals either from the brain to the body, and receive signals from the body that relate to the brain to provide sensory information, now you've got a skewing of that. So either you're getting spontaneous signal transfer because of the mechanical pressure. Everybody knows if they tap their funny bone, that they're going to feel something in their pinky. And that's mechanical pressure on a nerve. And so when you have that inside on a nerve system, but being the brainstem and spinal cord that relay all bodily important information from one end to another constantly, when you start getting mechanical pressure on that, even subtle mechanical pressure, you start getting things happening at a time when they're not supposed to happen. For example, you might have stomach acid being released out of your stomach without the presence of food, because your atlas has slightly nudged up against the part of the brainstem that then sends a signal through the vagus nerve to the stomach to say, hey, I think I just sensed food, but it really didn't. All there was a mechanical stimulus. Now the stomach is releasing acid, and a person's got a GERD, gastroesophageal reflux, because the vagus nerve has been stimulated by the atlas. And that's the simple, and it doesn't sound simple, but that's a simple version of mechanical compression or irritation on the central nervous system. But that brainstem region also houses a drainage channel that drains the CSF that your brain makes and is supposed to be released into your spinal circulation to bathe all the nerves and the rest of your spinal cord, only to come back up and get reabsorbed and run that cycle again. And so when you have that offset, not only are you putting mild direct mechanical pressure on your brainstem, but you're also squeezing off that tunnel inside that drainage tube. And so when your drainage tube is being squeezed off even slightly, the amount of CSF that your brain makes is no longer equal to the amount that drains through there down into your spinal canal. So now you're getting a backup of CSF up into your brain, which then has to go somewhere. So it starts to expand out. And the part of the brain that makes the CSF, the ventricles, they're the things that first expand. And once they reach their max, you'll get seepage out into the surrounding brain tissue. And that could potentially squeeze the brain and the cerebellum down. The cerebellum's a small balance brain at the back of the neck, top of the head. And that's what coordinates everything that happens in the body. And so that could potentially get squeezed down into the opening in your skull and further compress your brainstem, creating this vicious cycle.
So if you've got misalignment, you're facing potentially neurological problems. You've got flow of the cerebral spinal fluid issues. What about the vascular system, blood flow?
Same thing. You've got your vertebral arteries. You've got your carotids don't get affected as much by this, but the vertebral arteries, because they directly traverse through the actual entire cervical spine, they will be affected by this, especially when the vertebral arteries come up and at the atlas, they go inward and then up into the skull, into the brain. It's at that junction point where they take that 90-degree turn. If you now have this torque happening, you're going to put tension on the artery, and that tension will always equate to it being flattened out a little bit, which will restrict the flow. Now there is collateral, flow that can sometimes refill an area that hasn't been filled properly by its own artery. But still, if you have this progressive compromise, it will affect the amount of oxygen and nutrients getting to certain regions. So you'll either have a situation of hypoxia, or in the worst case, anoxia, and it could potentially at some point in time lead to a blood clot forming in that artery and releasing as an embolus and potentially having a stroke or something else that's vascular related, like a vascular event. And so it'll affect the arteries as well, 100%.
Okay, so there's a lot going on with this. Now, for people who've been diagnosed with multiple sclerosis, why is this important for them?
It's important for them for two reasons. When you have a reduction in this vascular flow, like the hypoxic situation that I just discussed, and just to take a step back, the gentleman that invented MRI, his name is Dr. Raymond Damadian. He passed away last summer at, I think, 85 or 86, but I had the privilege of spending 4 days with him in 2018, and he was doing research on MS at the time, and basically affiliating it with atlas subluxations. And what they noted is that in the scans that they were looking at of MS patients, that the so-called sclerotic plaques, which were these plaques of what appeared to be damaged brain tissue, in most cases had what they call a periventricular orientation. So those ventricles that I just explained that make the CSF, being the first things that then expand when you get this backflow of CSF into the brain, because it's not draining at the same rate because of potentially something as simple as an atlas being misaligned. That when you actually took those people and you did Nuka on them, or in their case, they actually used atlas orthogonal, which is, like I said, a derivative of Nuka, and they realigned the atlas, and then they performed the scan again, the brain scan on these patients, 30 minutes later, that some of those plaques had actually dissolved, indicating that the plaques were not a permanent damage fixture, but the hypothesis they made is that they went into a hibernative state. So they were not in a state of anoxia where they weren't getting oxygen, but because of that expansion of the ventricles, the peripheral tissue right around the ventricles of the brain was the first thing that was getting these compressive forces. And when the tissue gets compressed, it also doesn't get enough blood perfusion, even if there's enough blood there, because the tissue is compressed. And so around that region is where they see on people's scans a lot of evidence of these plaques or these white spots on the MRI. And the hypothesis, like I was saying, is that they were areas of hypoxia. So these brain cells went into a state of hibernation as opposed to death. And so when they actually realigned the atlas, it gave this refractory period where there was now perfusion of blood to that region. And because there was perfusion of blood to that region, this hibernative tissue that looked different on the MRI now restored its appearance on MRI. So the plaques actually disappeared. And in a lot of those cases, the plaques then reappeared because the person got misaligned again in their atlas. And so that's proved the point that the position of the atlas plays a crucial role. Now, whether it's the vertebral arteries, whether it's the compression of the drainage tube, whether it's shear compression of the brainstem, any of those three things or a combination of all of them could have led, and they proved that in these cases likely led to the compression of the brain tissue that surrounds the ventricles, causing this hypoxic state and what appears on an MRI as a sclerotic plaque.
Now, I've been having Nuka for, again, almost a decade. My experience with it has been positive, but not like dramatic. That said, I have had people contact me who've had dramatic results from just one Nuka treatment, or 3 weeks. Suddenly they're getting neurological function back, or they've had numbness or tingling that just simply just goes away. What have you seen?
I've seen most patients experience, I don't know about necessarily one treatment, but I think with a regimen of treatments of Nuka or AO, I've seen most patients get very, very good results. Again, dramatic, that's the subjective, in the eye of the beholder kind of thing. But I've seen very good results with that. There is a small percentage of those patients that don't have dramatic results. And it's not to say that the Nuka doesn't work, because I truly believe it does. But what I believe the missing link is that these patients that don't have the dramatic results, and they're almost always post-traumatic patients, so they've had some kind of a whiplash or concussion, is that they've sustained permanent ligament stretches or rips in their upper cervical spine where the atlas and the axis connect. So now the atlas and axis are actually sloppy. So you're always going to have some version of this happening at any given time. And the only thing that can coordinate that thing from going off alignment are the deepest core muscles in the upper neck that connect the atlas and the axis. And those muscles don't have an indefinite capacity to hold things together, so to speak. So they, like a marathon runner's calf, will fry out and seize. And when they seize, they could actually lead to a subluxation and an offset, which when you try to knock it back into place with Nuka, will actually knock it back into place. But because the rigidity of the muscles and the muscle memory, it'll pull it right back out of alignment. And so these people will not so-called hold their adjustments. And so what ends up happening, what I do, so like I've tried tying back to the beginning, I'm not a Nuka practitioner, but I affiliate myself with a lot of Nuka practitioners. But my mode of treatment is neuromuscular. So because of my own C1, C2 instability, I've learned that if I address those deepest core muscles that stabilize C1 and C2, and all it takes is direct sustained pressure held for a long time to the deepest level that you can tolerate, you can actually reset the functionality of those small little core muscles, where that every time this goes off, it'll knock it right back into place automatically, because these muscles all have sensors built into them that when the muscle feels itself stretch, it'll contract to bring itself back to neutral. And it keeps doing that like a tug of war all day long, or as often as much as it can, until it fries out. And when it fries out, that correlates to more symptoms, neurological symptoms. So then I'll go in there and I'll basically push out the lactic acid and get the muscle cross bridge to reset itself. So now it's going to govern that again. And I repeatedly do this throughout the day to myself. And that's the main mode of treatment that I use on patients. And the actual technique name is Nimmo-receptor tonus technique. And so the man that designed it was Dr. Raymond Nimmo in the 1950s. And he called it receptor tonus technique because these muscles, like I said, have receptors in them that sense stretch. And that's why when you test people's reflexes, they get this jerk response because you've stretched the muscle. And that muscle reflex goes back into the spinal cord. And the spinal cord tells that same muscle to contract itself. So you have this constant tug of war capacity. But because that's a continual tug of war, eventually that muscle starts sending nerve impulses into the brain, into the central nervous system, which then sends a different response down that is more of a long, sustained tone change. So the muscle actually changes its resting tension. And at that point in time, it's prone to causing this longer lasting subluxation, which is not amenable to Nuka or A or anything else, at least not very successfully. And that's where the technique that I use, where you're actually doing sustained acupressure or pressure on the muscle, works phenomenal. And it doesn't last. It has to be repeated regularly because the muscles will fry out again. Because the core problem is not the muscles, it's the actual permanent damage to the ligaments that should hold these things passively in alignment.
So if I suspect that I might have a misalignment, do I go to my doctor? How do I figure out if I've got a problem?
If you're suspicious of a misalignment, it always should be a chiropractor. And the chiropractor, if they have the capacity to take x-rays or some kind of imaging, that would be confirmatory. And I know the Nuka practitioners, that's their gold standard for deciding how to address correcting the atlas, is by very specific x-rays that would tell them which direction and what vector they need to use to align the atlas. For myself, I'm biased because I believe that motion x-ray should be the gold standard for anybody who either believes they have a subluxation or there's a suspicion that their recurrent subluxations are coming by way of an unstable upper spine where they have sustained permanent ligament damage. And by permanent, I mean it never repairs itself. So they will always continue to have evidence showing that they have excessive motion between their atlas and their axis. And that excessive motion, again, results in subluxations, which are misalignments, and in some cases not amenable, at least not sustained by Nuka treatments, where they will require something else. In the most severe cases, like I had a case of a patient who was diagnosed with ALS, who also tried Nuka, wasn't very successful. Not that it wasn't successful, but it didn't last. And so I assessed him with motion x-ray. We discovered that he had upper cervical instability and severe damage to his ligaments. And it was post-traumatic car crash. At the point that he came to me with a walker, and he could barely, meander his way into the X-ray room to have the imaging done. And he was, a fraction of a man. And we discovered that he did have permanent ligament damage in his upper cervical spine. And because of the diagnosis that he was living with and the severe neurological impairments, I triaged neurosurgery for him. And unfortunately, in Canada, there are no neurosurgeons that recognize this pathology. So I ended up triaging a neurosurgical evaluation and then a referral to India. And the most experienced neurosurgeon in this particular field with this particular part of the body is in India. And so the patient went to India within a matter of 6 weeks from that moment and had C1, C2 fixation surgery. So they basically fused C1 and C2. And from the moment he woke up, he no longer had ALS. So that is to say that, even though he manifested the symptoms that would be common to people, to neurologists saying, okay, this looks like ALS, it was literally his upper cervical instability causing severe brainstem compression and at a more often than not rate, causing him to have these neurological deficits. And once that was fused, those were all gone. So
Really?
he went back to being a 35-year-old father of 3 that could actually engage in life and go back to work. And yeah, absolutely.
So how do I find this type of treatment? If I'm watching this video, how do I get access to this?
To the motion x-ray or?
Like, where would I start? Where would I start? I think I've been diagnosed with multiple sclerosis or something else. I want to get this checked out. Where do I be?
I guess the first thing a person who has been diagnosed with MS would have to try to recall or think about is, have they in their past sustained a trauma such as a whiplash, a concussion, a loss of consciousness? If they have experienced some level of head or neck trauma, even if it's 15, 20, 30 years ago, and that substantially or sequentially later after that, they'll eventually get the diagnosis of MS. If there's a history of trauma, it again is my biased and humble opinion that a motion x-ray should be by far their gold standard, because if they have instability in their upper neck, this will explain a lot of things. And even if that leads then to, a Nuka referral with Nuka treatment to try to see if just aligning the atlas can provide significant enough relief, that would be great. If that doesn't seem to help, then potentially meandering towards neurosurgical triage might be their answer, where now you align the atlas and the axis and basically bolt it together that way so there is no more misalignment.
Now we're talking about costs. That could be a big thing for patients. What kind of costs am I looking at?
I don't know 100%, but the rough ballpark for, well, the imaging, so the motion x-ray would be about $1,700. As far as surgical triage, this fluctuates, but I would say an average of 65,000 US.
Wow.
And there are some American neurosurgeons that do this, and the fees fluctuate, quite a bit higher than that. Even I've even heard, values up into 180,000 for this surgery. And there's neurosurgeons that do this in Southern Europe as well, and also relatively high, 120,000 euro, 180,000 euro.
But not everybody has to have the surgery.
Oh, no, 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 no. I mean, there are some obvious severe cases like this ALS diagnostic patient, but the vast majority, like myself, like it's possible, and like yourself as well, to live a relatively substantial existence with these problems. It's just a matter of knowing that you have those problems, so you can actually put it on a shelf and know exactly what it is that you have, so that you don't have the suspicion of something else possibly being the cause. And when you know what you have, you're able to create a toolbox that you can pick from depending on what level of symptoms you have at any given time, to try to mitigate those symptoms and bring you back to what would be an acceptable baseline.
So for
Some
somebody,
patient, yeah, some patients I have might get as bad as having, blurry vision, dizziness, ringing in their ears, temperature control issues, sweating issues, heart palpitations, digestion, so constipation, diarrhea, urinary urgency, even, tremors. And then once this is addressed, either from the neuromuscular fashion that I do or a Nuka treatment, that'll stabilize. And other times they might have only nausea, or they might have only blurry vision, but they'll have some neurological symptom that is not really explainable by, and they'll try to explain it by, probably didn't have enough to eat. I'm hypoglycemic or something like that. But the fact of the matter is that most of the time it's something in the brainstem being compressed, and it's not always the same thing causing these neurological symptoms. And if you can, mitigate it yourself, which, I have been doing for probably 22 years now, after I figured out how to do this. And it's not just the acupressure. I mean, there's breathing techniques, there's cold water immersion, there's using cold packs, supplementation, the type of water you drink. There's a whole gamut of things that all add to bringing you back to a sort of a neutral keel that is acceptable.
So when I go to the doctor, if I'm diagnosed with something neurological or having another issue, why isn't this being checked like a routine?
Lack of knowledge that it exists. And I think that, unfortunately, it has been my observation that when people go into the mainstream medical system and they come with a set of symptoms, it's generally the symptoms that are being listened to, and no or very little thought is going into what could be causing those symptoms. And so people are generally prescribed something that is intended to neutralize the symptoms that they're experiencing, as opposed to doing an in-depth search of which body systems could be causing those symptoms, and let's go evaluate those body symptoms. And unfortunately, I don't see that a lot. And that will require generally some kind of imaging, whether it's just a plain x-ray, whether it's a CT scan, whether it's an MRI, whether it's this motion x-ray, whether it's being referred to a Nuka practitioner that can evaluate with their own x-rays. It involves some kind of in-depth evaluation, plus very, very detailed questioning or intake examination, where you go through the person's health history in a lot of detail. I mean, it's not uncommon for me to see somebody who's had 20 years of neurological symptoms, and I'm the first person asking them if they ever had a neck or head trauma prior to that.
Now, what about the risks? I mean, for what we do, we try to keep things, science-based, low cost, which I think outside of having the major surgery, the cost can stay relatively realistic. Would you say?
Yeah, I agree.
And then risk. What risks do the patient population have?
From the standpoint of imaging or the treatments themselves?
Treatment.
None. Worst thing that can happen is that it won't help. But I mean, as far as some kind of a major event happening as a result of the treatment, whether when we're talking about Nuka or this neuromuscular treatment that I perform on patients, there is no risk. The worst thing that can happen is, for example, the muscular technique, that they might be sore, like somebody's just tenderized their muscles, and worst case scenario, after 4 to 6 treatments, it hasn't provided any noticeable lasting benefit. At that point in time, someone like that may be a more logical candidate for at least neurosurgical consultation, if not specifically fusion. But then same with Nuka. I mean, there's no harm or no risk in performing a Nuka because it's a very mild technique. It's not a, the common chiropractic, high velocity impact technique. It's a very mild technique. And so the risk is, I would say, I mean, nothing's a zero risk, but I would say it's extremely small.
So is any of this, if you live in Canada, is any of this covered by the healthcare system, or is this all out of pocket?
No, well, I mean, the healthcare system generally no. So, your provincial healthcare systems, they'll only recognize mainstream medicine. So when a person goes to a chiropractor, and I believe this is true in Alberta, I know this is true in BC, that the government health insurance doesn't cover anything for chiropractic. But most people have extended benefits, whether it be through Blue Cross or Green Shield or one of those other providers. And so they will have chiropractic treatment coverage. And a lot of those plans will also have chiropractic x-rays covered as part of that. Now, as far as the $1,750 motion x-ray charge, they would only cover a fraction of that. So it ends up being, out of pocket pay. And I believe it's the same for Nuka. I'm not sure what Nuka x-rays cost these days, but if a person does have extended benefits, it would cover a portion of that if they did have chiropractic x-rays in their plan. But yeah, I mean, and again, to go through 4 or 6 or 8 treatments, it's not going to break most people's bank to try that. And if it is, if it is proving to be beneficial, the wonderful thing about the technique that I use is that people can be empowered to do that on themselves. They don't require the dependence of having to see me. I mean, oftentimes having somebody else do it is better because they can address things from different angles and get at it better. But I would say 90% of the time, a person can mitigate themselves if they train themselves or get trained how to do this and implement it on a regular daily basis. It's very useful.
Now, I think one thing it's important for our audience to know is that you actually do this on yourself, correct? Like you did this on you because of the problems you've had.
Every single day.
Yeah. Can you share that with our audience about how that works?
I can. I mean, I also have a YouTube channel that I started specifically for these types of things because I explain this so often that I felt there was a need to actually have something there that somebody could, because when I explain it to them, it's one-on-one. And they go home, they try it, they might not get it, and they're usually hesitant to go, let's do that again. And so I had the videos put on my YouTube channel where I actually show exactly how I do it to myself. And there's an explanatory video there. They're in my shorts, explaining the anatomy of that and where you want to be pushing. But in a nutshell, if I turn my head away and I go onto where my atlas would be, which is roughly halfway between the bump on the back of your skull, and there's this big bump in the middle, which is C2. If I go halfway between there and I just press, and sometimes I'll reinforce with my other side and just support, I'm not going to be pushing back. And I'll hold that for roughly about 20 to 30 seconds. And I can actually feel the referral going up into my head, which tells me that these suboccipital muscles are actually connected to what I'm feeling in my head. And then once I've done that, it'll actually relieve the tension in my head because I believe that this thing gets realigned because the muscles are now supporting that properly.
And you do this because you had problems with concussions. And I can only, is this true?
It was a diagnosis of a concussion, but it was actually, it was a upper cervical ligament sprain. So I, sustained instability in my upper neck from a concussive blow.
And you've been able to, I guess, heal yourself through this?
Heal, I don't know if heal's a strong word, but I think definitely improve upon the dysfunction and impairment that I could have if I wasn't doing this to myself.
Now, my audiences are all over the world. If people want to get a hold of you to kind of talk to you, to get a consult, how can they get a hold of you?
Probably the easiest is to just email me directly. I'm very open about that. I allow people to email me all the time, and I do my best while I'm in my patient flow on a daily basis in between patients to just get back to people. If it's, excessive, there might be a fee for that, but if it's just a little back and forth, I'm happy doing that. But the best email is DRB, so Dr. B @blaskovich.com. That's the easiest way to get a hold of me.
And people need to physically go see you to get, say, the x-ray and this.
Not necessarily. Sometimes they've had imaging done. Like people from Africa, from Europe, from Australia, Tasmania will contact me, trying to get some answers because they've heard via that there might be a chance I might be able to see something on their imaging. So I will generally, provide that service where they can upload their imaging for me to look at, whether it's MRI, CT, regular x-rays, whatever it would be. And I'll evaluate it after I've heard a little bit of their, health history and symptom list. And then I'll provide them with annotated image findings. So whatever I found on their imaging, I'll annotate and put markings on there. and then I'll review that with them on a Zoom call like this and explain to them what I see. And again, it's just one man's opinion, but generally nobody else has seen the things that I see when I'm explaining that to them. And so it can be useful for them to be able to take that back to somebody in their local geographic region that's working on therapies with them and point out the certain things and say, well, this is, based off these findings, this might be a better path for us to take treatment wise. So no, people don't specifically have to come to me. If it is related to having a motion x-ray done, because there's not a lot of those trickling around the world, then yeah, they would have to come to me. But I try as much as possible if they're really far away to try to look at what they've already had done. And if there's any nuggets in there that are useful for their particular problem, I'll share that with them and then they can kind of run with that wherever they live.
Okay, well, thank you so much. Is there anything else you want to add before we wrap up?
No, I appreciate what you're doing, and I'm glad you're doing this because I think it definitely needs to become a lot more mainstream and discussed openly as opposed to just little snippets like this where there's so much knowledge and so much capacity to help people like this that again mainstream is not even touching because the symptoms need in their minds the symptoms are always needing to be addressed with pharmacology as opposed to something tangible.
Okay, well, thank you, Sasha. And people
Thanks,
can
man.
get
Appreciate it.
for all the information below how you can get a hold of them.
Awesome. Thanks.